going to be really quick, like simple with the exposition, so you have enough time to make questions. Because usually when I do this kind of presentation, I take a long time answering questions about dentistry that you don't feel comfortable asking your dentist. So you can ask everything that you want here. I'm currently doing a dental assistant shadowing at a dental office. So I'm more like experienced in dentistry in this country. I'm from Colombia. I graduated as a dentist in 2017. I worked as a dentist for a year, and then I came to this country 6 years ago. And this is the first time I'm being in a dental office shadowing, so it's a big deal for me. Okay, so the most important thing about brushing your teeth, guys, is first to have like an order, because the most common mistake is when you forget what surface of the tooth you brushed. So when you start disorganizing and doing this around all the mouth, you just don't really go truthfully in each side, which is really important, because you have to make sure you go the same time, or at least like truthfully every single surface of the tooth, like consciously, that you clean the whole area. So the first tip that I will going to give you is to start by quadrants. So what we do to make a diagnosis in anyone's tooth as a dentist, we split the mouth in 4. So we split it like in the middle of the face like this, and then like from upper and down, right? So what I do and what I teach to my kids, because I also work with kids, is to start with the upper right. That is the easiest. If you are like right-handed, that is the easiest way. If you are left-handed, you can like start with this, but remember to do the upper right too, right? So the right way to brush for adults is to make sure the brush, the soft part of the brush goes inside the gum, right? So the horizontal type of brushing, that is this is recommended for kids, but it's because they don't have the right motor skills to do this movement. That is from like inside the gum out. You are trying to remove the food that is going inside your gums. That is what causes gingivitis. That is what causes bleeding in your gums when you floss. And even when you brush your teeth, if the gingivitis is really severe and chronic, you will have like bleeding when you brush your teeth and you spit out and the saliva has blood. So the important part of brushing your teeth is removing the food you ate, like every meal, and you have to make sure that the gum is being touched by the brush, not just doing this, right? I know the tooth is what you get more concerned of, because it gets cavity and it looks bad when you have a filling that is not like color you want, and it's painful and also can affect the nerve. But the gum is really important too, because that is what gave you the bad breath. The halitosis is the scientific name for bad breath, that like even if you don't feel it, other people will. And that is the thing that is one of the most common causes that patients go to the dentist, because they smell bad, and also because they can lose tooth through the gum sickness. So make sure that you are removing from inside the gum out, and you can start with this surface all of the way from the upper arc or the maxillar. So we call this the maxillar, and this is the jaw, right? So we remove very well, and then you come back to the right side and you open your mouth, and this is the right way to brush the occlusal part of the tooth. So we have the buccal or vestibular part, the occlusal part, and the palatal or lingual part. So these are all the surface, but the interproximal, that is between each tooth, the only way to clean this area is with the floss. So do not miss the floss, don't skip the floss. The floss is needed every single day of your lives. It's not once in a while, no, every other day, once in a week, once in a month. No, it's every single day. I actually recommend it every single time you brush your teeth, but most of us, we don't have time. I include myself there. So at least do it at night. That is the time that your mouth stays like without any activity, because talking, eating, that removes food, and it makes like the bacteria moving in the mouth. But when you are asleep, you don't move your mouth that much. So you won't remove all that food or prevent the food organize and the bacteria get together to produce the cavity. So that's why I recommended to do it at night. If you have to do it, at least do it at night. That will keep the area clean for all the hours you are not going to talk, eat, like swallow. Okay, so that was important to know, because I won't be able to teach you how to clean this area, because this typodon doesn't allow me to put it in. But after you do all the occlusal area of this side, in the front side we call the incisors. You don't have occlusal, you have incisable board. That is how we call it, and we do it this way. So always removing all the food, because it's really common, people that don't get cavities get tart. Tart is like food that gets hard behind your teeth, and it's really common in your lower teeth, in your lower incisors. And also if you have like some retainers that are stick to your teeth because you had orthodontic procedures, that really like affects the people who has those. And this is the way to brush it, okay? Then, after you go to the incisal, you come back to the occlusal, and then you do the palate. So you come back here and you remove in the same manner. This technique is called Wigman modified. If you look in Google, you can see YouTube videos about that. So look, you already went through the whole arc, so you are sure that your maxillary is clean. So then you go back, you go down, so you don't have to go up here, down here, then here, and then you forget what you did, and you don't really pay attention what you really brushed. So you start the same in the vestibular part of the lower teeth, all the way in the front, then the occlusal.
No.
Please.
These people fall asleep.
There, come there.
No one again.
Okay, and lingual, make sure that the tongue is all the way up. Okay, so now we brush all the surface we could reach with the brush. Then when you bite, you close your mouth, and it's really, in here, that is really helpful to do it together and like redo this area, right? And you can do it in circles instead of this, so you touch the gum. You are massaging the gum. You need to massage the gum. You are like avoiding the bacteria. You are like the purpose of the brushing is not have a 100% cleanliness in your teeth, which is really hard because the saliva also have bacteria. The purpose is disorganized. It's like mess the bacteria up. So because when they get together for too long, that is when they can cause the acids that causes the cavities in the tooth. So the acid, the produce of the bacteria when they eat all the like glucose that you eat during your diet, that is what produces the cavity. So that will be for another exposition. But it's really important to disorganize. So as long as you touch the gum, it's really helpful, and it kind of encourage your gums to produce a liquid that removes that food that it has inside. Okay, so this is all that is like the basics that you do. Also, don't ever forget the tongue. The tongue carries so many bacteria that you remove all of these, but if you didn't brush your tongue, that also will give you really bad breath, and it will reposition the bacteria you had there and you didn't clean on the teeth, so they will migrate. So never get the gum. Usually the gum has to look pink, and you can share your your tongue after you eat, and it will look white. So keep brushing until it's like light pink. Okay, so that is why I usually teach like patients in like special smiles, like Olympics. I volunteer and I do this kind of education classes to kids and to grown-ups, and so I hope